Hello, my name is Brett Hiring. I am the Pharmacy Manager with BJC Home Infusion. Today we will discuss the process for performing your infusion utilizing your IV access and Freedom 60 pump. First, we will identify a clean, non-cluttered surface to lay out our necessary supplies. Next, we will collect our supplies. We will need 2 saline flush, 1 heparin flush, at least 4 alcohol pads, the Freedom 60 pump, and our medication. It is best to remove your medication dose from the refrigerator 1 to 2 hours prior to your dose to allow it to acclimate to room temperature. Now that we have all supplies laid out on our work surface, we will perform hand hygiene. To do this, we will wash our hands with warm water and soap for at least 30 seconds. It is important to work up a good lather and properly clean all surfaces of your hands, paying attention to get spaces between fingers and under fingernails. It is best to utilize paper towels to dry your hands, as dish towels can harbor bacteria. If you do not have access to a sink and water, it is sufficient to utilize an alcohol-based hand sanitizer, as long as your hands are not visibly dirty, though the hand sanitizer must be at least 60% alcohol to be effective. To utilize hand sanitizer, we will place a dime to quarter-size amount in the palm of one hand. Utilize the same procedure as hand washing. Make certain to cover all surfaces of both hands with the hand sanitizer. Again, paying attention to get spaces between fingers and under fingernails. Then allow the hand sanitizer to fully dry. Now that we have performed hand hygiene, we will put on gloves and are ready to begin preparing the syringe and the Freedom 60 pump for administration. Obtain the Freedom 60 tubing and remove it from the package. Be sure to note the F rating of the tubing. Remove the white protective cap from the end of the tubing with the light blue disc. Remove the cap from the end of the syringe and connect the tubing to the syringe. Make sure that the pump is set to off and that the black tab is wound all the way to the back of the pump. Load the syringe into the pump. Make sure that the luer disc is fully seated in the nose of the pump. Now we are ready to prime the tubing. Turn the pump on. You will hear a buzzing followed by a click as the black tab engages with the plunger of the syringe. Now loosen the white cap on the end of the tubing. Once a few drops come out of the end of the tubing, re-tighten the cap. Turn the pump off and wind the knob clockwise to remove pressure on the syringe plunger. Next, we will begin the sash process to administer our medication. First, get an alcohol pad. We will now scrub our catheter access, or scrub the hub, with alcohol. It is important to wrap the alcohol pad fully around the threads of the needleless connector and scrub vigorously for 30 seconds. Allow the excess to dry, then connect your saline flush. We will then unclamp the pinch clamp on our access. Now we will flush our line using a pulsating flush to ensure that the catheter is functioning properly. If you note any increased resistance to flushing or are unable to flush your access, first, ensure that the pinch clamp is fully opened and that there is not a kink in the line. If you are still having difficulty, contact your infusion provider for further assistance. Once we have flushed the access with saline, we will clamp the line. Disconnect the saline flush. Next, get another alcohol pad and scrub the hub for at least 30 seconds. Allow the needleless connector to dry completely. Remove the cap from the end of the Freedom 60 tubing and attach to the needleless connector. Turn the Freedom 60 pump on. The infusion of your medication has now begun. The rate of infusion is determined by the nominal flow rate of the tubing. During the infusion, the fluid level in the syringe will decrease as the plunger moves toward the syringe tip. Check on the device every 15 to 20 minutes during your infusion to ensure that it is operating appropriately. When the infusion is complete, the syringe plunger will be at the end of the barrel of the syringe and the syringe should be empty. Prior to disconnecting the infusion, we will again perform hand hygiene as described earlier. After performing hand hygiene, we will don a pair of gloves. Then we will clamp the IV access and clamp the Freedom 60 tubing. Then we will disconnect the tubing from the needleless connector. Get an alcohol pad and saline flush. Scrub the hub for at least 30 seconds and allow to dry. Once completely dry, connect a saline flush. Unclamp the IV access and flush utilizing a pulsating flush. Clamp the IV line and disconnect the saline flush. Get an alcohol pad and scrub the hub again for 30 seconds. Allow the needleless connector to dry fully, and then connect a heparin flush. Unclamp your IV access and flush with heparin utilizing a pulsating flush. Clamp the IV line and disconnect the heparin flush. Lastly, wind the knob on the pump clockwise to move the black tab all the way to the back of the pump. Remove the empty syringe. It is important to remove the syringe after each infusion is complete. This improves pump longevity and ensures continued performance. You have now completed the process for administering your IV medication utilizing the Freedom 60 pump. Things to be mindful of during this process. Always review your medication label instructions prior to each infusion to ensure correct administration and that you are infusing the correct medication in the event that you are on more than one IV medication. Always make sure to perform good hand hygiene prior to each infusion. Remove your medication from the refrigerator 1 to 2 hours prior to your dose. Times when you should contact your infusion provider. If your catheter is not functioning or allowing you to flush it. If your occlusive dressing has become wet, dirty, torn, has blood beneath it, or is coming off. If you are running a temperature greater than 100.3 degrees Fahrenheit. If you begin to develop a rash or itching at your dressing site or anywhere else on your body. Any pain, swelling, redness, or warmth in the arm where your IV access is placed. Any onset of diarrhea or changes in bowel habits.